So Takotsubo Cardiomyopathy is kind of a fun name for something that we in the medical field term stress cardiomyopathy. So it is an acute heart failure syndrome that can be triggered either by emotional stress, physiologic stress, neurologic stress, and sometimes no obvious trigger at all. It's most common in women who are typically over the age of 50. And I think there was a big study that reviewed about 1,700 patients with this condition. And I think over 80% of them were women. So it definitely tends to be more predominant in females. But as for between other races, ethnicities, it doesn't tend to have, or at least we don't notice any different predilections from that standpoint. So it is commonly referred to as broken heart syndrome because I think one of the first associations was in people who had had a big emotional stressor happen to them. So oftentimes it will be a person, again, often a woman, who may have had something awful just happen to her, like a loved one died or had a major life stressor, and they start having chest pain symptoms and they think they're having a heart attack and present like a heart attack, but then are found to have no blockages in the arteries of their heart. And so it can happen to people, again, who are acutely in the process of grief or emotional stress. And so that's kind of where that name comes from. I think that it is less rare than we previously realized. It was only recently described, in the last 25, 30 years probably. It's probably been happening more often than we realized. And so for a cardiologist at a big academic institution, I wouldn't say that it's rare for me to see it because we get called on these patients a lot. But we're more and more recognizing how common it is actually.